Hi, my name is Dr. Mabea. I'm a gynecologist and fistula surgeon.
Ni ko Dr. Hilary Mabea, inendet nikitau sipitalit nebo Gynocare nemiten taonitab Eldoret, nekikoik nemiten tai en kanyoiset nebo miondo nebo fistula.
I started doing fistula surgery more than 20 years ago because when I was a young doctor, I was posted to the West Pokot region. This is a pastoralist community which moved from one place to another. They suffer from a lot of obstetric fistula. This is a fistula that results from prolonged and obstructed labor, meaning that the mother is in labor for so many hours. She's not able to get access to the hospital. In the process, she gets obstructed labor. The baby dies inside the womb. By the time she gets to the hospital, the baby has died, and there's a lot of injuries to her bladder and her rectum. So this mother now, she loses her baby, then she starts leaking urine and stool uncontrollably. And they are very poor women who get this kind of complications. So when I worked in that region, I saw this kind of patients. We didn't have specialists who were able to take care of these patients. So they suffered for years and years. I saw women who suffered for 20 years, 50 years without care. We used to have only 1 year flying doctors coming in to operate on these women. So I had to wait for a whole year for these women to get treatment. That's why I actually decided to go back into the year 2000 to study obstetric gynecology. And then I went to Ethiopia at the Amlin's Fistula Hospital to study fistula surgery in 2002.
Arorwech Dr. Mabea agobo ole kibitunen tetutiet nebo Campaign 52 notok kituitos kanyoik chebo emetab Kenya ak chebunu emotinwekab sang kila kenyit en sipitalit nebo Gynocare asikokoito kanyoiset nemakiliponi en kwonyik chebune kaimutionotok.
Due to the friendship I had with colleagues from Germany, World Frida Hospital, I've been going there every 2 years actually to assist my colleagues there to do operations together. Patients from Africa who end up in Germany. Some are refugees. So we have ended up having every 2 years attending a congress, a colproctology congress. In the process, operations are performed and some of the patients are from fistula and FGM. So we have had that opportunity. So 2 years ago I was giving a presentation, which I've been giving every 2 years in Berlin, Germany. And some of my colleagues, after the talk, they came to me and asked me, how can we help you? Then I told them that in where I come from, in Africa and some Asian countries, sub-Saharan Africa, we have so many patients suffering from obstructed labor and fistula. So I told them that if you could come, that will really give us more hands, more expertise, because we are not many surgeons in the country. We're around 10 surgeons in Kenya at the moment, and we have so many patients. Every year we have 3,000 new cases of obstetric fistula, and maybe 20,000 women are actually there in the villages who suffer from this condition. So we had a discussion, and last year, 2024, in April, they started Campaign 52. Campaign 52 means treat at least one woman every week for a whole year, 52 weeks. That's how the idea came up, but we surpassed that number in April last year. We did about 90 patients, and that was really a great thing. So the team that came here decided to come again this April 1st to actually do even more operations, because then they saw the need. They even saw patients who had fistulas after radiation from cervical cancer, which is a preventable condition.
Noah Koskei ko administrator nebo sipitalitab Gynocare na arorwech agobo tokyinetab kei nebo Campaign 52 nebo kenyitab 2025.
Campaign nebo kenyini kitauge tarik 1 arap ang'wan agoi tarik 11 ako kitorchinigei kele kakiyai operation chesire 100. Kiborchinigei 100 amu kenyit konye kikokitokyigei kele kimeche keyai operation 52, lakini kikinyoru wagonjwa zaidi nebo 52. Kikimuch keoperaten wagonjwa 93. So ko TCA kora kiborchinigei kele TCA objective nenyonet kemeche keoperaten wagonjwa 100. Yae Campaign 52 ni ko the second Campaign 52 ing tisia kiae kila kenyit ako kiit nekitokyinigei kot mising komeche kero kele kakiityi chepyosok tugul chekikonyor fistula ako masich toretet eng wakatit noto no kimakat ketoret ko kikele kiae kasini kila kenyit sikobit keityi icheket eng kimoswek ole mitei because ngilen iro ng'alekab treatment nebo fistula komi barak kot mising ako memuchi age tugul mgonjwa age tugul toretet noto no so ko kikile kaikai sikeyoe kila kenyit kotoretech Dr. Abbas nemuch keityi kila mgonjwa eng ole mitei sikobit konyor toretet.
Agenge en kanyoik chemiten tai kora en kasuldaetab tetutiet nebo kanyoiset ab fistula en sipitalit nebo Gynocare ko Samuel Munyoki ne kaboiboichi inendet kakwautik chekikoib kanyoik chebunu emotinwekab sang korutechi emetab Kenya kila kenyit asikonamgei eun ak kanyoik chebo Gynocare en kakoitoetab kanyoiset nebo fistula.
So when we have campaign 52, I'm one of the most excited people because I know we'll be able to mobilize people who can help us to do more campaigns around, reach more women and change people's lives, and that is the most impressive part. We also have a lot of inputs in terms of skill because we do have doctors traveling from as far as Eastern America where they have to fly for about 24 hours to get to Kenya, self-sponsored to come and give their expertise. They sponsor their journey, their stay, everything. They mobilize for supplies. They carry them along with them. They come, they participate in the surgeries. So we get a lot of expert surgeons, plus our own fistula surgeons who are trained in Kenya, who are very good in fistula repairs. And at the end, we have very good outcomes.
Akot ngandan chang kanyoik chekomongei kila kenyit en tetutiet nebo campaign 52 ko manyumnyum boisiet neyoe icheket. Arorwech Noah akobo agenge en koimutik chekoik konukut en kokoitoetab toretet koityi kwonyik.
Top challenge nekitinye saiti ko kenyor wagonjwa ichoto. Ingel ng'alekab fistula ko melen kinelen makukee chito saya kole uroni anendet kecheng bichoto ko marahisi. That's why kere kele kispendani rabishek chechang kechenge wagonjwa ichoto amu kibendi akoi emet nebo Kapenguria, kibendi akoi Siaya, kebendi Migori, across the country kechenge wagonjwa ichoto. Ko challenge neo noto na amu ngiro ole kinyorchini wagonjwa ichu komi remote areas ako komangee chito ako sai kole atinye fistula ko wi. Ko nguno lazima ibun biik chemi community itou ing'ololchi itou kelipani alak tes community ku promoters komutech ole mitei bichoto cho lakini komangee chito kole uroni anendet ko wi.
Age kora en koimutik kotiengei Samuel Munyoki ko nebo kwonyik cherutechin sipitalishek amanyoru kanyoiset nemakat kosubkei ak naet nematindoi alage en kanyoik kotinygei ak miondo nebo fistula.
Women sometimes seek treatment, but they sometimes they land in people who are not conversant with it. So they are told you can take pills and it will resolve, or they are told it will just go after some time. Some of them are taught some exercises. They are taught it will go. So it can happen that the patient has taken effort to go, but the place she has gone, she didn't get the right help. And if somebody doesn't know, they don't know that they don't know. So they give what they know. Some women just hide away because of the embarrassment. And there's one patient who came to me and said, for 30 years I was wondering, how will I tell a doctor that I'm leaking stool? Because she thought it was very offensive to say that to a person. And she gathered courage, eventually she came and I told her, it is normal, it can happen. So we have two incidents of community awareness and also health worker awareness on fistula.
Akot kounotok koboru boiboiyet Dr. Hilary Mabea en boisiet nebo komonut neyoe kanyoik en sipitalitab Gynocare missing ko nekoyai sipitalinotok koik agenge en sipitalishek chekiyokto biik chemiondos chekotemenen konyor kanyoiset en sipitalishek alak.
I think we are so honored to I'm so honored also to have Gynocare as a FIGO training center. It is the only FIGO accredited training center in Kenya. FIGO is the international organization for obstetricians and gynecologists worldwide, based in London. So it gave us recognition to train doctors here at Gynocare. We train doctors from all over Africa. We train doctors from Europe. We train doctors from the North America. Actually, we train doctors from Asian countries. Like now, we are expecting 2 doctors from Bangladesh in the next 2 to 3 weeks to come here for training. And this is our, like I can say, a final referral center for any type of fistulas. If the patients have been operated elsewhere and the operation did not take well, or it did not become successful, all those patients are actually sent here. Like this is our final point for any fistula surgeries in the country. And we are so proud to be in that category whereby actually we are like the last hope in terms of patients who are suffering from fistulas.
En let kokakon kurset administrator Noah Koskei en biikab emet komongei en tetutiet nebo campaign 52 nebo kenyitab 2025 asikonyor toretet ak konyor kamuget nebo kowekchigei sobet nekibo tai ak nebo lelesta.
Le kong'eteke tarik 1 arap ang'wan arawanito nenyone ako tarik 11 keyoe operation en Gynocare Women and Fistula Hospital Eldoret nemite Kahoya Estate karibu miti moja. Ko kiborchinigei kele toretet noto mite ketoreti wagonjwa tugul especially chetindoi fistula ako kora cheboto ng'alekab cancer. Mite kora ng'alekab cancer program nekokiteshi nekoker bichoto kole amu nguno supportenete program patients ikabit wakati noto kokakele keteshi patients chebo cervical cancer program kemeche tugul kora sikobit